In this lecture, I will give an overview of the phases involved in carrying out a needs assessment, then take a closer look at some specific methods for collecting data. Over the past 4 decades, there have been a proliferation of needs assessment models and tools, offering users many approaches to choose from. Generally speaking, however, there are 3 phases to a needs assessment. Number 1, exploration and identification of project needs. The purpose of this initial phase is to determine the overall scope and plan for the needs assessment, to ensure that implementation goes smoothly and generates useful information for decision-making. To do so, first you must settle on the specific needs you want to address. Development issues are complex and interrelated, so you should decide if you want to address multiple related issues or just one. Next, you must narrow down the key questions you want answered. In other words, what do you want to know by the end of the assessment in order to inform decisions on next steps? Your assessment objectives will flow directly from these questions. In this phase, you'll also need to determine what data will be required to adequately address your objectives and what the potential data sources will be. This is an opportunity to take stock of what information already exists so you don't duplicate data collection efforts. You should also select who your partners will be, both internal and external partners, as well as who will be involved in the assessment team. The scope of your assessment may be shaped by various factors, including institutional capacity and resource availability, people, funds, and time. This is a good time to ensure there is organizational and project commitment and funding to proceed. Toward the end of this phase, you should have all your data collection tools and protocols developed. Ideally, prior to beginning actual data collection, you should pilot test your tools with people from the target population and refine the tools accordingly. This will also be the time to train your data collectors and make all the arrangements. For example, schedule interviews, focus groups, surveys for your upcoming data gathering process. The second phase of needs assessment is data gathering and analysis. At this stage, you are collecting the information you need to better understand the gaps or the needs between where you are and where you want to be. Data may be collected for internal data you may have already about the target groups, or collected externally, including surveys or interviews and analyses of secondary data. Secondary data might include epidemiological data from government or donor sources, health facility data, and/or data from other organizations implementing similar projects, or a public policy review. I will talk more about data sources in a moment. After the data are collected, they are organized and analyzed. The module on gathering and using data covers this data cycle. Finally, the third phase of needs assessment is utilization and making decisions. This phase is where the data you analyze are used to create a plan of action and implemented. In this phase, project manager and team set priorities, evaluate possible solutions, apply a cost-benefit analysis if needed to determine which solution is best in light of the relative costs and benefits of each. Formulate a plan to implement the solution, and then allocate resources necessary for implementation. The goal of this phase is to develop a realistic plan of action to close the gaps between current state and desired outcome. I will discuss this phase more in a future lecture this week. Using data to make decisions in projects is covered more in the module on gathering and using data. Let's talk about some approaches for collecting data for needs assessment. A needs assessment, when possible, should use existing data and evidence and not duplicate the efforts of others. One of the challenges when collecting data is that the process can be highly subjective. People, as individuals and as a member of social and interest groups, can have different ideas about what should be defined as a need and what should not. Remember, when collecting information, try to separate facts from opinions. Ask people for their opinions, but also ask them to support these with facts. Ideally, you will be able to collect a combination of qualitative and quantitative data gathered from various sources, as this will allow you to triangulate your data and enhance the rigor of your assessment. For example, opinions might arise in a focus group that healthcare workers need more training on a given topic. These opinions can be strengthened or weakened by reviewing facility data, interviewing patients, and/or doing direct clinical observation. There are different methods and related tools that can be used for needs assessment data collection. I will not have time to go into detail on all of these, but I will review some of the more commonly used approaches in development work. The primary goal behind all of these methods is to determine key areas of unmet need and the most appropriate interventions to address them. One of the methods is community mapping. Community members make a map of their community that identifies the resources available in it. This can be used to start a discussion about existing resources and gaps. Another method is SWOT, or SWOT plus analysis. Ask the community, organization, or stakeholder group to identify its own strengths, weaknesses, opportunities, and threats. SWOT. With SWOT plus, you can combine the advantages of brainstorming with an approach that identifies the relationships among the defined SWOT, assigns values to each, and then uses those relationships and rankings to guide decisions about next steps. Another approach might be a pairwise ranking. Stakeholders brainstorm and compile a list of needs and compare each need directly against the others on the list to get a better understanding of which needs are the greatest. It's best if several groups with different interests do the ranking separately and compare results. Problem trees. The roots and the fruits of the problems as perceived by the target population can be plotted as a tree diagram. This can be useful when trying to identify unknown root causes of problems, which can be used to guide intervention decisions. Practice review. A routine review of notes, charts, prescribing, letters, requests, etc. can identify learning needs, especially if the format of looking at what is satisfactory and what needs improvement is followed. Other methods for data collection include interviews, questionnaires, surveys, focus groups, and document review. These are covered in the module on gathering and using data in the projects. It's worth briefly exploring a few of these within the specific context of needs assessment. Let's start with observation. In facility settings, healthcare workers can be observed performing specific tasks that can be rated by an observer, either according to known criteria or more informally. The results are discussed and learning needs are identified. Observation is also commonly used, usually with a detailed checklist, to assess infrastructure, equipment, and/or supply availability and quality. Focus group discussion. Focus groups are useful for identifying needs and constraints that might be missed through other methods of assessment. They tend to have more nuance and depth than close-ended surveys or questionnaires and can often get closer to what stakeholders are really thinking or feeling. Focus groups are often paired with quantitative approaches for this reason. And finally, desk review. Common to needs assessments are reviews of inventory documents, finance reports, human resource documents, and facility records. In summary, there are 3 phases of a needs assessment: exploring and identifying project needs, gathering data and analyzing data, and finally, using that data to make decisions about how to address the needs you have identified. There are many methods and tools you can use when conducting a needs assessment, such as community mapping, SWOT or SWOT plus analysis, problem trees, and focus group discussions, to name a few.